dynamics therein, and the case management report associated with it. That will be delivered by the Ghana Health Service. So may I call on Mrs. Mimi Datson of the Food and Drugs Authority to join us with a quick update on RDT test kits.
Thank you very much, Honorable Minister. This is just to give an update on Cbody rapid diagnostic test kits in Ghana. Just to give you a brief on what they are. Antibody rapid diagnostic test kits are supposed to be used for preliminary screening or emergency screening in a country where resources are limited. They use blood and they give quick results and they look out for antibodies. Antibody test kits are supposed to be registered by the Food and Drugs Authority before they can be used. They are classified as what we call Class 4 medical devices. And the Food and Drugs Authority has a guideline for registration of these medical devices, and you'd require an import permit to bring them in, even if they are for personal use. According to best practice, international practice, all RDTs must be validated in the country for that which they are going to be used and in the population in which they are going to be used. So you'd have heard that people would be bringing in RDTs, say from China, from the UK, from the US. You can't use it in this country unless they have been validated in Ghana for use. This validation is done with the Food and Drugs Authority in collaboration with Noguchi Memorial Institute for Medical Research and with the Public Health Reference Laboratory in Kolebu. Normally you have what you call an international reference standard for RDTs with which you use to validate this RDT, and that is the acceptable practice worldwide for validation of an RDT. However, when this is not available, as the case with COVID RDTs, you validate an RDT with what we call the gold standard. And for the gold standard, this is what you call the PCR kit. The PCR test is what is used to validate the RDT. The acceptable criteria for RDT validation is a sensitivity and a specificity of 99%. So what applications have we received so far? From 16th April 2020 to 17th July 2020, we have received 34 RDTs for validation. These RDTs have come in from Ghana, one from Ghana, China, USA, Canada, Korea, Finland, Malaysia, Singapore, and UK. I will just give you an idea of what we have so far for all of them. Taking all of them into consideration, we have a specificity of between 85 and 99% and a sensitivity of between 4 and 54%. Please bear in mind that I said an RDT that is validated should be 99% before it is considered acceptable for use. Now, the sensitivity of an RDT when it is done and when it is considered acceptable is that the sensitivity test is done, and it is what identifies people who are positive to the disease or who have previously contracted the disease. So if you say that a test is sensitive, it means that it is called a true positive. It means when you test somebody who is considered sensitive, they would have had the disease before or they are currently having the disease. The specificity of an RDT determines people who have not been exposed before. So it is what we call the true negative. Why do we require an RDT to be highly sensitive? If an RDT is highly sensitive, it means that all the true positives will be captured. If it is highly specific or specificity, it means that all the true negatives will also be captured. So the fewer false results you have, the better it is for the population. Antibodies tell us who had the virus and how far wide it is spread. Yes, it's a quicker method to use than maybe the PCR. It is some of them 15 minutes and you have your results. However, for antibody tests to be useful, we need to be able to trust the results they give. Currently, considering that most of the people who are having or who get COVID are showing no symptoms and or showing very few symptoms, this is the more reason why highly sensitive RDT is most important for this population. So now, all the RDTs that we have tested are ranging between 4% and 54% sensitivity and 85 and 99% specificity. Thank you very much.
Thank you, Mrs. Datsun, for the update on the status of RDT test kits and the work that the FDA has been doing to answer the question whether or not we have